Hello, everyone. Today we are going to discuss periodontal disease and diabetes systemic connection. It is presented by me, that's Shreya, Bishra, Bishraben, Ramandeep, and Ayushi. Next slide, please. So the contents we are going to discuss are something about diabetes, classification, sign and symptoms, periodontitis, periodontitis effect on diabetes, and diabetes effect on periodontitis, treatment and management, a fun fact, questions, and references. Next slide, please. So about diabetes. Diabetes mellitus is a group of metabolic disease that leads to high level of blood glucose, that is hyperglycemia. In this disease, a body does not make enough insulin or does not use insulin well. As per data, Public Health Canada, that is from 2020 to 2021, 3.7 million people were living with diagnosed diabetes mellitus. Diabetes is also one of the leading cause of death in Canada. Diabetes is a very common chronic disease and its prevalence increases with age. Next slide, please. There are various types of diabetes. The first one is type 1. It is an autoimmune condition in which beta cells in the pancreas create little to no insulin. It accounts for 5 to 10% of cases of diabetes. It is not preventable, and the person suffering from this disease needs insulin therapy for life. Next slide. Type 2 diabetes. It accounts for 90 to 95% of the cases of diabetes in Canada. Type 2 diabetes is preventable or at least can be delayed with proper lifestyle modifications. In this type of diabetes, beta cells does not produce enough insulin either due to decrease in number of cells or impaired function of the cells. Over to Vishnu now.
Okay, so now let's discuss about the types of diabetes. The gestational diabetes occurs in 10% of women who give birth. It is a temporary condition which resolves after giving birth to the child, but it increases the risk of type 2 diabetes later in life. Other types are There are other factors which can lead to diabetes, like medication, genetic mutation, or disease that can lead to diabetes. We are not going to discuss this in detail in this presentation. Diabetes insipidus, the cause due to lack of antidiuretic hormones. In this our body produces a lot of urine, up to 20 liter per day. We are also not focusing on this type of diabetes. So these are the symptoms as per CDC. Urinate a lot often at night. They are very thirsty, lose weight without trying, very hungry, have blurry vision, have numb or tingling hands or feet, feel very tired, have very dry skin, have sores that heal slowly, have more infections than usual. So let's talk about the periodontitis. It is a common chronic inflammatory disease characterized by destruction of the supporting structures of the teeth, cementum and periodontal ligament and alveolar bone. Pathogenesis involves two components: bacterial infection and host response. So bacteria present in pockets initiate an oral inflammatory response followed by destruction of supporting periodontal tissue. Destruction of periodontal tissue occurs once the host response is compromised. Look for clinical signs such as gingival bleeding, periodontal probing depth, radiographic bone loss, and tooth mobility. It progresses through 4 stages to classify the severity and extent of disease based on the measurable amount of destroyed tissue because of periodontitis. Look for risk factors such as diabetes and smoking. Specific types of periodontitis are chronic periodontitis, aggressive periodontitis, periodontitis is manifestation of systemic disease like diabetes, cardiovascular disease, or certain genetic conditions, and necrotizing periodontal disease. Now, my friend Raman will take over.
So now it's the chronic periodontitis. It is most frequently occurring form of periodontitis. Main characteristics include pocket formation, gingival recession, and subsequent bone loss. It can occur at any age and usually occurs slowly, but periods of rapid progression can occur. It's shown in the picture as well. Now is the aggressive periodontitis. It is a destructive gum disease that causes rapid loss of bone and gums in healthy people. It has early age of onset and usually starts in adolescence or adulthood. Next slide, please. Now, periodontitis as manifestation of systemic diseases like diabetes, cardiovascular disease, or certain genetic conditions. Diabetes is considered as a major risk factor for periodontitis, which is confirmed by epidemiological data. There is a two-way relationship between hyperglycemia and severity of periodontitis. Risk of periodontitis increases by threefold in diabetic individuals as compared to non-diabetic individuals. And majority of research states that type 2 diabetes mellitus is at greater risk for periodontal disease. However, type 1 diabetes mellitus are also prone to periodontitis. Next slide, please. Now it's the necrotizing periodontal disease. It is the most destructive and rapidly progressing form of periodontal disease, most common among young adults. It is an umbrella which includes necrotizing gingivitis, necrotizing periodontitis, necrotizing stomatitis. And patient typically has gingival bleeding, tissue necrosis, and papilla has punched out appearance. Next slide, please. Here is the staging and grading of periodontitis. First, see the periodontitis staging. In staging, it intends to classify the severity and extent of a patient's disease based on the measurable amount of destroyed or damaged tissue as a result of periodontitis and to assess the specific factors that may attribute to complexity of long-term case management. Here are the 4 stages, and they are described on the basis of severity, complexity, and extent and their distribution. Next slide, please. Now is the grading. Grading aims to indicate the rate of periodontitis progression, its responsiveness to standard therapy, and periodontal and potential impact on systemic health. Here is the criteria for the grading, grade A, B, and C. And there are some grade modifiers as well, which includes risk factors like smoking and diabetes. Next slide, please. Now, diabetes effect on periodontitis. Patients with diabetes are prone to develop oral complications such as gingivitis and periodontal disease, fungal infections, and caries. Periodontitis is recognized as one of the major complications of diabetes. The risk of periodontal disease is 2 to 3 times higher in adults with diabetes. About 1/3 of people with diabetes have severe periodontal disease. Those individuals who do not have their diabetes under control are especially at risk, and the level of glycemic control is the key to determining their risk. Many studies confirm that patients with poorly controlled diabetes have more serious clinical symptoms of periodontitis, such as exploratory bleeding, plaque index, clinical attachment loss, compared with those without diabetes or well-controlled diabetes. Now my friend Ayushi will take over.
So now we will discuss periodontitis effect on diabetes. Periodontitis negatively affects diabetes by worsening glycemic control and insulin resistance, increasing the risk of diabetes complications and promoting systemic infection. Periodontitis increases the chances for systemic infection, which worsen other diabetic complications such as heart disease. Severe periodontitis can make it harder for people with diabetes to control their blood sugar levels, leading to higher HbA1c levels. Periodontitis and diabetes affect each other. They have a strong bidirectional relationship, that is a two-way relationship. Management of periodontal disease is essential to prevent development of diabetes-related complications such as cardiovascular issues. Next slide, please. Next slide, please.
It's not working now.
So now we will discuss diagnosis and treatment. Although regular hygiene is important for everyone, but people with diabetes should pay more attention with their gums and teeth. People with diabetes should undergo yearly comprehensive periodontal evaluation in addition with brushing and flossing twice daily. Interprofessional collaboration should be implemented so that team can work together in monitoring changes in patient diabetes and dental health. Now we are at the end of our slide, and now we will discuss some fun facts. So people with diabetes want to schedule appointments early in morning after breakfast so their blood sugar can be stabilized. Before lab test, diabetes can be diagnosed by oral symptoms. Healthy gum health can actually help in controlling blood sugar levels. Diabetes is a leading cause of blindness. Dr. Frederick Banting and his team in Toronto developed the first effective human insulin treatment in early 1920s. And one more fun fact that type 1 diabetes cause is still unknown, but it is not caused by eating more sugar. Next, please. Now we have a question. Can managing periodontal disease improve diabetes outcomes? So the answer of this question is yes. Managing periodontal disease will improve diabetes outcomes, as we have discussed earlier in our slides that it is a bidirectional relationship, and clinical studies have shown periodontal treatment can reduce the HbA1c levels. Thank you so much. These are our references.